Bismillahirrahmanirrahim. Primary ciliary dyskinesia, a rare cause of chronic respiratory disease and usually encountered in adult respiratory clinics as a cause of bronchiectasis. Many gene defects have been identified in primary ciliary dyskinesia, causing a number of cilial abnormalities. Abnormal cilia do not beat normally, leading to reduced mucociliary clearance, microbiological colonizations, which further inhibits cilia action, chronic infection, and the development of bronchiectasis. The main aim following diagnosis in childhood is the prevention of the chronic respiratory disease and bronchiectasis. The clinical features of primary ciliary dyskinesia may present with neonatal respiratory distress, situs inversus in about 30% of cases, as cilia determine the site of the organs. Random organ setting occurs with cilial dysfunction, hence the situs inversus of Cartagner's syndrome. There is nasal blockage, rhinitis, chronic otitis media, persistent wet cough in childhood, hearing problems, and history of blue air and grommets in childhood. Clubbing and signs of the chest disease are rare in childhood. On auscultation, we can hear wheezes in 20% of cases. Regarding infertility, there is infertility in PCD due to motile sperm. Sperm tails have some or have same morphological defect as the cilia and do not beat correctly. In adults, the disease usually presents with clinical signs of bronchiectasis. The cough is productive and the sputum is purulent, and there are recurrent chest infections and intermittent hemoptysis. Diagnosis: saccharine test, which is nasal mucociliary clearance test, and nasal nitric oxide is very low in PCD, possibly because nitric oxide mediates ciliary function. This is the most sensitive and specific screening test. Ciliary biopsy via the nasal route. Cilia are examined by high-speed digital video where they beat frequently and the pattern can be assessed, confirming the diagnosis. Most cases of PCD are diagnosed in childhood. There is an increased frequency in the children of consanguineous marriages. Consider the diagnosis of PCD in bronchiectasis, situs inversus, persistent upper and lower respiratory tract infection from early childhood, and infertility in male side. The male may present in infertility clinics. The management of PCD in adults, this includes treatment of secondary bronchiectasis with antibiotics, physiotherapy, vaccinations, management of hemoptysis. The last important point of primary ciliary dyskinesia is that the disease is autosomal recessive occur and there are more than 200 phenotypes. That's all and thank you.